It was a long time ago, 1983 or 84, and I was at Vegetarian Summerfest with my little baby, and I saw this really tall guy, and I said to somebody, "Is there a basketball player?" And they said, "No, he's a medical doctor." And I thought, wow, we've got a medical doctor? Everything is going to change now. And you know what? Some things did. Hi, everybody. I am Victoria Moran, and I think I've told that story before, but oh my gosh, to me, it is such a good story. Because although I know one or two medical doctors wandered through the vegetarian vegan movement prior to the early 1980s, I never met one until Dr. Michael Klaper. And he carries not only the promise of the future of how people are going to eat and relate to their health and relate to other beings, but he brings character and sincerity and the most beautiful quality that we can all be proud of as being part of this movement. And I'm absolutely thrilled today to be welcoming Dr. Michael Klaper and his wonderful book, Moving Medicine Forward, which is really the culmination of a lifetime of work in this field. So it is such a pleasure to welcome Dr. Klaper. I know you know him. I know he doesn't need an introduction, but just in case somebody is brand new to all of this, we can say a few things about him. Dr. Klaper went to the University of Illinois. He has been practicing medicine for a very long time and as far afield as Australia and Hawaii. And what he's been up to lately is the organization that is the name of this book, Moving Medicine Forward. So it's not an idea. It's not just writing and talking and hoping something happens. It is getting in the trenches, as he has been known to do, in medical schools and bringing the wonder of plant-based nutrition to these eager young students so that the future of medicine is different, very different. Welcome, Dr. Klaper.
Thank you, Victoria. It's lovely to be with you and your viewers, team.
Oh, well, it's wonderful, wonderful to be here. I know you're on the circuit. I know you're talking to everybody with this new book. So speaking to you right now, and I realize we'll be posting this a week or two after you and I talk, but I can say today that last week, it was suggested by RFK Jr. that nutrition be taught in medical schools. And I would love to be happy about that. But because I don't know what he means by nutrition, I wanted to get your take.
Oh, well, that obviously a huge issue, and doorway has been opened, a little crack here, and potentially good things can come through that doorway, and we want to make sure they do. And so the question, of course, is what will be taught in medical schools. RFK got a commitment from 53 of the nation's medical schools. That's a third. There's about 160 medical schools in the United States. And he got a third of them to commit to 40 hours of nutrition training during the 4 years of medical school education, which is only 10 hours a year. Nutrition is not very much, but compared to the zero that most doctors will see, or the pittance, the 10 hours that turn into learning about scurvy and beriberi and nutritional diseases you're never going to see. 40 hours of solid nutrition education certainly would be a quantum leap to a better understanding of the effects of the patient's daily diet upon the body that they bring to us doctors to health and repair. However, as you're mentioning, the question is what will be taught during those 40 hours. And I'm the executive director of our nonprofit organization, Moving Medicine Forward. And our primary focus has been going to the medical schools lecturing the medical students and the medical residents, our intended physicians, about the ability of a plant-strong diet to reverse chronic disease. But now, thanks to Mr. Cavendier's crew, we have another layer of mission that we want to make sure unfolds properly. And that is, we are going to be following these 53 medical schools. We're going to find out what the curriculums they are proposing that be adopted, what exactly is going to be taught in each of these medical schools, because it's going to be different in each school. And we will summarize the findings, see who's got the most forward thinking and the most plant friendly curricula, and we will encourage others to follow in that bill. But we're in the era, and we're dealing with people who are strong believers in the carnivore diet and the keto diet and all these meat-based diets, and so they're an ascendancy right now. They're going to learn the hard way. Mother Nature's not impressed with their politics, and what we can talk about, what I think is going to happen from unfortunate advice that's being dispensed. But for right now, they say when the dog plays the violin, don't criticize the quality of the play. The fact that he's playing it all, and it's wonderful. The fact that the HHS is talking about nutrition education for doctors, wonderful. That's great. We just want to make sure that the plant-based side of nutrition education is honestly represented.
I want to ask you, as a person of science, when you talk about the plant-based side, you mentioned scurvy and beriberi. With diseases like that, there's no plant-based side. Everybody knows what you need to do for those. But for general health, for prevention of degenerative disease, there seems to be this difference of opinion, and science isn't supposed to be about opinions. Help us understand how we got here.
Well, as you say, the opinion enters in when industry and monetary money interest starts shaping the curriculum that gets taught. As far as the science goes, there's no question when it comes to reversing chronic diseases, high blood pressure, type 2 diabetes, clogged arteries, autoimmune disease, inflammatory. There's no question the journal articles are replete with articles showing that a plant-predominant diet can be key in reversing these diseases. I've not seen any long-term studies showing that a meat-based diet can reverse any of these diseases. In fact, they usually make them worse, of course. So the science is there, but I think Upton Sinclair said that there is difficult to convince a man to accept a finding when his paycheck depends on him not accepting that. And I think we're in that same situation here. And there's other factors. Of course, there's a huge institutional inertia to keep things as they are. The pharmaceutical folks want to keep those drugs being supplied. The surgical instrument folks want to keep those surgeries being done. And they pay lots of money to the medical schools, and they certainly shape the curriculum that's taught. And so the true science can get subverted. But if we're just, that's why we feel so confident that they have an honest look at the science. The effectiveness of the plant-strong diet will certainly rise up to the top. It's going to demand to be taught. If it's not, it's going to be such an obvious distortion that we will certainly bring that to everybody's attention as well.
It's wonderful to know that there is solid science and there is sketchy science, but for lay people, it's hard for us to ferret it out. So you and our other wonderful plant-based doctors and all of their writings and teachings are so helpful because, sometimes you see a headline and it seems to contradict everything that you thought was true, everything that we thought was true.
Yes, and it's unfair. It makes me shake my fist at the wind a bit in that when people adopt, especially these meat-based diets and ketone-producing diets, there's initial improvement in many cases. People do lose weight. Why? Because these diets, as much I disagree with the carnivorous flavor, so to speak, that most of them have. They do have they espouse some principles I agree with. They say you shouldn't be eating refined carbohydrates, white bread, vegetable oils, or refined sugars. And so if you pull the flour products and the dairy products and the oils out of your diet, people are going to get leaner. And weight loss is very health promoted. Yeah, their lipid panels improve, their insulin resistance decreases. And when these initial improvements show up, they say, aha, see, the carnivore diet is the best, it works. And so these, what they're seeing, these short-term studies, the 3-month studies, 6-month studies, and you'll see these improvements. But the problem, of course, is if you follow people along on a meat-based diet for 10 years, 20 years, you follow a population line of people eating meat 3 times a day, I'll put a $1,000 bill on the table that within, and you watch, within 36, 48 months, the medical journals are going to be erupted with articles of carnivore diet shows increased risk of colon cancer. Paleo diet shows increased risk of vascular dementia. Meat-based diets are increased risk of autoimmune disease from gut leakage. And my right eyebrow will go up this much. Yep, that's right. Mother Nature doesn't care about the politics and who's paying for the studies. And we're plant-eating hominins by anatomy, by our physiology, and to eat a meat-based diet is a violation of natural law. And Mother Nature's, they're pretty consistent about the consequences of that. And so the pendulum swung over to the neat folks at this point, but be patient. That pendulum going to swing back, and the studies are going to hit the 6 o'clock news, and suddenly we're going to be talking about it on the podcast, and those veggie burgers are going to start looking pretty good. And the plant-based diet, but oh yes, well, we knew that all along. So I tell people, don't be seduced. Like our late colleague Dr. John McDougall said, people love to hear good news about bad habits. And so with this particular set of people and the doctrine, and now, oh, you can all the steak you want, you can all the bacon you want, or saturated fat is good for you. And it's embarrassing already that fellow countless doctors and the scientists are promulgating this. But also people jump on it. Well, our doctor said I could eat all the meat I want. And that's what the new inverted pyramid will have you believe that they put out. Yeah, but again, we have fingers on our hands, not claws. We've got short, small mouths with flat, grinding molar teeth and rotary jaw joints for chewing up apples and noodles. We don't have big fangs in our mouth. We're not carnivorous apes. And the enzymes in our saliva, the first digestive power that our body has that contacts our food, it's a starch digesting enzyme. We have starch digesting enzymes in our saliva. If that is not a clue from the universe about what we ought to be eating, we're clearly starchivores. And again, any deviation of that is going to take us very much in the direction of disease. So I tell people that if it's a 6-month study, take it with a big grain of salt. I don't care. I want to know how people eat these diets for 5 years, 10 years, 20 years. Well, show me the stroke incidence. Show me the heart attack. Show me who's still alive in 10 years eating that kind. I guarantee you'll see a huge gap open up with between the plant eaters and the meat eaters when it comes to long-term survival rates, etc. We need to honor our anatomy. We are plant-eating creatures.
Yes. Well, I do want to talk so much about moving medicine forward and what you are doing to do that in the medical schools. But before we move it forward, I do want to ask you to go back and tell the story of the surgery that you were part of as a young resident, I believe, and it changed how you looked at diet.
Oh, yes. I had been a general practitioner for 7 years, and gotten very frustrated despite my best efforts to keep my patients healthy. And wagging my finger at them, take your high blood pressure pills, take your raise your insulin dose. No one's getting healthier. They were moving in the other direction. They were getting more obese, more ill. I'm getting calls to the emergency room. My patient, this one's had a stroke, that one's had a heart attack. I got so discouraged, I left general practice and decided to become an anesthesiologist. And I did almost 3 years as an anesthesia resident in Vancouver. And I had found myself on the cardiovascular anesthesia service, dealing with people's hearts and blood vessels. And day after day, I'm putting patients to sleep and watching surgeons open their coronary arteries and removing these big globs of greasy, waxy material called atherosclerosis. And there are already studies in the medical journals saying this is basically the fat and cholesterol of the animals these people are eating. And I never had the pathology report come back on one of these plaques. It's remnants of broccoli, rice, and tofu. It's always oxidized cholesterol. And there were studies already in the journal suggesting that these plaques could be melted away on a low-fat diet of whole plant fruits. And now my dad died of clogged arteries. I know I've got those genes, and it really caught my attention that I should change my diet to a plant-based one. And one day, I'm during a case with a surgeon, a fairly obese surgeon. I'm not fat shaming, just the reality of it. Was more obese surgeons that I've ever worked with. And it was a long procedure. It was a 7-hour 4-vessel bypass and a ventricular aneurysm repair. And the OR team limped down to the cafeteria after 7 hours. And I'm going through the cafeteria line right behind that surgeon. And much to my amazement, I watch him load his tray off with a cheeseburger and a milkshake and a slice of cream pie. And I'm thinking to myself, I am working in a Fellini movie. And your younger guest listeners may not know who Federico Fellini was, but he made these films of these bizarre characters, surreal appearances, exaggerated facial and body features. And it felt like I'm working in one of those movies. And I realized at that point, from what I knew about my own health and mindset of the colleagues I'm working with, God love them, they did good surgery, but that's not where I belong. And so I changed my own diet, adopted a whole food plant-based diet. My body loved it. Within 12 weeks, a 20-pound spare tire of fat melted off my waist. My high blood pressure went to normal. My cholesterol went to normal. I felt great waking up in a nice lean body every day. And at that point, I realized I did not want to be an anesthesiologist and spend my career literally putting people to sleep. I'd rather go back to general practice and help them wake up, because now I realize the light went on. And now I see why my patients are more obese and sick from what they're running through their bloodstream every 4 hours with every cheeseburger and bacon and breakfast. And so I left anesthesia with 6 months to go in my residency, much to my parents' dismay. Yeah, you know the money you earned every year. But it wasn't in truth for me to pursue that line. I hold anesthesiologists in great reverence, but I went back to general practice, helped my patients adopt this plant-based diet. They experienced the same wonderful changes. And I became the happiest doctor I know. My patients got healthy before my eyes. It's the most gratifying kind of medicine that you can practice. And that's why we're going to the medical schools with this message. They can be the happiest doctor they know, but they open their minds to the effect of their patient's diet on these diseases they're spending their careers treating.
Well, it's a wonderful mission. This is a wonderful book, Moving Medicine Forward, What More Doctors Should Know About Nutrition and How It Can Save Your Life. And even though it says what more doctors should know, this is a very readable book. I want everybody to know you do not have to be a doctor. You don't have to have even done well in science class. This is a great book with really usable information for all of us right now. But I do want to talk about what you are doing with the medical students and what kind of responses you're getting. First, how did this idea germinate? And what was the response early on when you started contacting medical schools?
Oh, thank you. Well, partly when I left anesthesia and back to general practice, I was looking for a proper setting to practice my nutritionally based medicine, and fortunately, dragged my feet to a wonderful institution in Santa Rosa, California, called True North Health Center. And it's an inpatient facility. People would come and stay for days, weeks often, and they would be fed a whole food, plant-based food stream. And the changes we see in these people was nothing short of spectacular. The obesity begins to melt away within the first day or two as the magnesium and the potassium and the vegetables work their way into the walls of the arteries. The arteries would relax and dilate, so blood pressures would come down. There was an anti-inflammatory diet. Their joints would stop hurting. Their eczema skin would clear up. Their bowels would start working again, and they would transform into normal, healthy people right before your eyes. There was this most spectacular transformation in all of medicine. And so the true health care helps people regain their health instead of just managing their symptoms. And so after 8 years of being on the staff at True North, I'm saying, this should be standard practice in medicine. And, the people who really need to know about this are the medical students, the first, second, third year medical students. I wish someone had told me when I was a medical student that high blood pressure is reversible. We get the opposite message. They will take these pills the rest of their life, lifetime medication. I wish someone told me type 2 diabetes is reversible. Once on insulin, always on insulin, always gets off insulin. Well, not only can you get these patients off insulin, you have to get them off, because as they lose weight and their insulin receptors open up, their sugars come down normally. You inject them with more insulin, that the blood sugar is going to drop dangerously low. Same thing with the high blood pressure pills. Not only can you get them off of blood pressure pills, they lose weight, their arteries will regain their health. And only can you get them off pills, you have to get them off before they stand up and their blood pressure drops to their boots and they pass out on it. So the reversibility of these chronic diseases is such a profound concept that somebody should be telling the medical students this before pharmacosclerosis sets into their brains and they think that drugs and surgery are the only treatment for these illnesses. And somebody should tell the medical students this. And a little voice on my shoulder says, "How about you?" And so starting in 2019, I started traveling to the nation's medical schools and giving our lecture, What I Wish I Learned in Medical School About Nutrition. And we go through the science of why a plant-based diet reverses high blood pressure, why a plant-strong diet reverses type 2 diabetes. And, show me the science. We need to give them the confidence that this is scientifically sound, which it is. It's a beautiful physiological understanding to understand, to acquire. And so I have, throughout 2019 and 20, I was living in airports and hotels and medical schools. And the response has been very positive from the medical students. You implied in your question, how do you get in the door? Because the administration of the medical, they don't want to hear this message. It threatens their treatment models. It threatens their financial models. It's California woo-woo stuff as far as they're concerned. The truth is, the science is solid, and we provide plenty of documentation. So we just do an end run around the administration. And the American College of Lifestyle Medicine, a remarkable organization who focuses on these underlying qualities and who are very pro-plant-based diet, they've been around on the scene for a few years, and their their concept is caught on so much that in most of the nation's medical schools and many of the hospital and teaching hospitals, there are so-called Lifestyle Medicine Interest Group, LMIGs. And these are medical students on their clinical rotations, as well as family practice residents, internal medicine residents. And they form Lifestyle Medicine Interest Group, and they meet once a month, and they talk about, so they bring up articles referable to lifestyle improvement and creating health improvement. And so we have a list of all the LMIGs in the country, and we find the student or the medical resident, the head of the local LMIG, and we contact them. And we go directly, how would you like to have Dr. Klaper come and talk to your LMIG or participants about using plant-based nutrition to reverse disease? Well, we almost always get a very enthusiastic welcome. So we go right to the students. We just do an end run around the administration. Because it won't be many years because many of these students are going to be the administration. They go into medicine. So time's on our side with this. And so the students have been very, very enthusiastic. Because I tell them, when you're a third-year medical student, you want to learn how to get those medical powers. You want to learn how to use diuretics to make edema go away. You want to learn how to use antibiotics to make pneumonia go away. Well, this is the most powerful clinical tool you will ever wield. You want to reverse diabetes, you want to reverse high blood pressure. You want to heal these patients. You just want to manage their chronic disease. You want to heal these patients and get real about why they're sitting in front of you, doctor, in a body that's overweight, hypertensive, atherosclerotic, diabetic, and inflamed from what they went into their arteries every 4 hours. Help them get on a whole food plant-based diet and they save their own lives, and you can give them the greatest gift of all. The students are so open to this message. It's such an empowering one, and so I'm the happiest medical teacher I know because their eyes light up. I get these lovely feedback messages from them, and you can't unring the bell. Once you hear what you know about, you see. Once they hear this, it changes everything they see. It would have changed my entire medical career if I had known this as a medical student. So hopefully, like Johnny Appleseed, we're throwing out the seeds of knowledge, and they'll sprout. And we're going to see a new generation of young doctors who know the importance of their patients' diets in reversing disease.
Oh, that's wonderful. Because I think a lot of people, especially younger people who haven't had to deal with illness or anything, haven't seen doctors for much more than an annual checkup, expect that if there's something wrong and you go to the doctor, you'll get education. You'll be told, well, this is what's wrong. Here's what you can do to make it right. And I think it's a rude awakening for a lot of people of, oh, wait a minute. You go to a medical doctor, you get a prescription, or hopefully not a surgery, but maybe that. And that's just been, historically, those are the two things you get. It's kind of like the old phrase, you don't buy bread at the hardware store. And you go to the medical doctor and you get the drug. And then, of course, the drug can cause problems of its own. Something I've seen with my husband, my listeners know that he's gone through quite a bit in the past few years, is that you can be someone who isn't in the world of pharmaceuticals, and one hospitalization can get you on not just a single medication, but a host of medications that all have different effects and that are possibly not working very well together. So how do you bring in this entirely different way of looking at health and disease? And I know you're not saying that there's never a time for pharmaceutical intervention, surgery, all those things have their place. But for so much in terms of degenerative disease, lifestyle is front and center, but that's not what the system has been built around. So you're not just offering a new idea. A new idea would be a different kind of drug. You're offering a revolution. How are you being met when you bring that?
I have no illusions that this is alien to most of my colleagues. It is, and it's threatening to some of them. I'm a surgeon, you're going to say, well, I'm not going to be doing as many bypasses, and a cardiologist, I'm not putting in as many stents, and this is how these folks make their living. But there's always going to be congenital heart disease. There's always going to be need for surgery. We want to get our people healthy. And what is it? Let the truth be told, though the heavens fall. best I can do is be an honest broker of information and bring this information to practicing physicians as well as the younger, embryonic ones that are just on their way to their physicianhood. And the book, we're trying to create a practical, wholesome, doable approach. I have a chapter on the red tide, what floods through your bloodstream after every cheeseburger meal, every fried chicken, pepperoni pizza slice. Yeah. That's the free radicals, the glycogen products, the fragments of animal muscle, the oxidized cholesterol. I call it the red tide that flushes through every tissue, every cell in the body. And that's the root of these chronic diseases that fawns inflammation or fawns artery clogging, insulin resistance, etc. But towards in the following chapter, it's because we explained that these are reversible diseases. If you stop flooding the red tide through the tissues every 4 hours and eat a whole food plant-based diet, these diseases will largely reverse themselves. And so chapter 5 in the book is a day in the disease reversal clinic. And what a nice concept to be able to walk in a hospital and see an orthopedic clinic, surgery clinic, disease reversal clinic. Boy, that would be nice to see that sign there. Well, the truth is every doctor's office should be a disease reversal clinic. We want to gift the medical doctor, the reader, with this idea that he could be supervising reversible disease. I say I'm the happiest doctor I know, but one reason I am is because every day in my office, I get to lean across the desk and ask a question that my conventionally trained colleagues never get to ask. I have to ask my patient, how does that get rid of your diabetes? How does that get rid of your high blood pressure? How does that get rid of your lupus? I thought that they can be free of these diseases is a gift in itself. But you make their patient an active partner in their own health and help them change their diet. I have plant-strong dietitians that will do the counseling for me. Because the doctors say, well, I don't have time to do this counseling. I don't want to get paid for it. You don't have to, doctor. There are plant-based dietitians who will do this counseling for you. And I tell the patient, here's the contact information for Miss Jones or Mr. Smith, the plant-strong dietitian. You contact them, do a telemedicine consultation with them. They'll talk to you about what to eat. They'll send you handouts. They'll show you videos to watch. You eat like they're telling you for a month. You come back and see me in a month. Let's see if you're not leaner and healthier. We'll talk about getting off some of these medications. And I tell people, students, that's the medical model. That's how medicine should be practiced in the 21st century. And I put that in the head of the practicing physician reading. And they go, that's interesting, because it's not much different than what they're already doing. And pull the dietitian onto your treatment team and help him or her reverse the diseases here. And you'll become the happiest doctor you know. And the patients, when they read the book, though, at the end, they'll know these are the questions you ought to be asking your doctor. Your doctor ought to be working with you to disease reversal. And people say, I can't find a plant-based doctor. You make your own doctor plant-based doctor by talking with them, give them a copy of the book, and say, I want to work with you to reverse my diabetes, get off these insulin shots. I want to work with you. Will you work with me to help give up my blood pressure pills? And assume you wind up educating your doctor, and this book will help lubricate that process as well. So it's one of the main reasons I wrote the book.
Yeah, it's a wonderful gift book for doctors. I already have a list of those who will be getting this gift. So I wanted to ask you about the pharmaceutical industry. A lot of people and a lot of my listeners are very wary of the pharmaceutical industry. I think if this were a movie, they would be the villain. They would be the one that needed a superhero to come and work things out. So when lifestyle medicine gets as big as we want it to get, backlash, what's it going to do to big pharma?
Fascinating question, and we'll see. Now, I'm very grateful to have antibiotics and beta blockers and all these life-saving drugs. Thank heaven for them. And blessings on those very smart women and men in those research labs turning out these amazing drugs that can do these wonderful things in the body. But by and large, these drugs, with the rare exception maybe of antibiotics, they don't cure any disease here. They control the symptoms. There are chemical wrenches to raise the titer of this and to lower the inflammatory factors of that. But they're not getting at the root of the problem. And that's a major concern of all of us, basically. And so, and the classic among those are the new GLP-1 drugs, these appetite suppressants that help people lose weight. But we see it's a horrible double-edged sword because people often, they don't change what they're eating. They may eat less meat and cheese, but they're still running the red tide through their tissues every few hours, and they're still going to go ahead and get more heart attacks and strokes and cancers, etc. It doesn't get to the root of the problem. And it gets me angry or frustrated in that people say, well, I got to keep taking these Ozempic for the rest of my life, because if I don't, that weight's going to come right back up. And this is the specter that's haunting all the people on these drugs. Well, yeah, if you keep eating cheeseburgers and pepperoni pizzas, yes, that's what's going to happen. The weight will come right back up. But I tell my patients who are on these drugs are a gift. And yes, they help you lose weight, granted, and help you get a better understanding of food. But use this time that you're on these drugs to learn how to eat a whole food, plant-based diet. So when you eventually taper off of them, that weight won't come back. Shoot right up. In fact, it's going to, weight loss are going to continue until you get down to your normal weight there. So with all these drugs, the antibodies, the anti-inflammatories, whatever, that are now advertised every evening on TV there, they may have a place to help you get hold of your inflammatory disease or psoriasis, whatever it is. But those underlying diseases, mostly are coming from our gut and what we are eating. So while you're on these wonderful, amazing pharmaceutical drugs, learn how to eat a whole food, plant-based diet. So when you eventually taper off of them, you're still a healthy human being there. So it's not necessarily a conflict, and they can be used in concert with each other. But health comes from healthy living, as Dr. Goldhammer says, and a meat and dairy-based diet just is unnatural. It's not a healthy diet for us. So that trumps, sorry, the term, but it trumps anything else. So that should be the focus of anyone on these new medications.
So you mentioned Dr. Goldhammer, you've mentioned True North Health, where people go to learn to live healthfully and also to fast, supervised water fasting, which I have heard called nature's operating table. And amazing healings do happen with that. Is that something that you bring up with the medical students?
Not usually, unless they ask in the Q&A session. There's a whole book on itself. Dr. Goldhammer just wrote a lovely book, Can Fast and Change Your Life or Save Your Life? And he's certainly the expert on that, though I supervised hundreds of fasts when I was on this attending staff at True North for 8 years. And I have such respect for the fasting process, what the body does during the fasting state, how it quells inflammation, how blood pressures come down, and they self-clean themselves out in this process called autophagy. It's a remarkable state. But again, I used to have a T-shirt where I made rounds at True North there. It's not the fast, it's what you eat after the fast is the real issue, of course. So fasting is a great, powerful tool. It's like being on the operating table on a cellular level. But still, it's the food that you know, flooding to your tissue with every meal from the fast on that really is going to be determining of health. But I have great respect for fasting.
Yes. So I'm going to ask a question that you're not being asked on the big podcasts and TV shows that go out to the general public, because most of my listeners are in the plant-based world already. And that is that our different leaders in the plant-based and lifestyle medicine movement seem to have some differences on some of the fine points. You mentioned the late Dr. McDougall, starchitarian, loved potatoes. Now, Dr. Furman doesn't want us eating white potatoes, lots of veggies. Dr. Ornish is still, I think it's 6 whole grains a day. And, not as many veggies necessarily unless you want them. So, and then, you mentioned lupus and Dr. Goldner and so much with the flax and the greens and the green smoothies and more raw food. So even within our world, there's a little bit of confusion. How do we ferret through that stuff?
Wow. Important point, and it depends again who you are, and as far as your own body, your own preferences, your own social situation, who do you live with, your attachment to food, how frightened you are of that twinge of chest pain. There's all sorts of. Everybody's at a different place here, and they have to come to terms with a whole food plant-based diet as to how it best fits into their life situation. If they're at home with an adamant, angry carnivore spouse, that's a different situation. Or if you're raising infants there, you make some accommodations there. But by and large, getting to the real thrust of your question there, start with the understanding that we're talking about a whole food, plant-based food stream here. So right there, it's a minimal processed food. We can talk about that, whether Impossible Burgers have a place anywhere. But by and large, if you're eating whole foods like you could recognize them growing in a garden, they're lettuce and peas and corn and broccoli, if that's the majority of your diet, you're going to be fine. And you need fresh foods in your diet. Everything can't come out of packages and boxes, so you want at least a good salad every day. And now we're understanding the importance of healthy and substantial amounts of plant protein in the whole form. And that basically comes down to legumes, the protein stars in the plant world. Anything in a pod is a legume: beans, peas, chickpeas, lentils. And so I tell folks at least once a day, if you can, get some leguminous entree into your diet there, whether it's a hummus sandwich or a scoop of lentil stew or a bean burrito or a bowl of bean chili or our salad. We have a nice colorful salad every lunch. We open up a can of cannellini beans and throw it, or chickpeas, throw it on the salad there. Get the legumes into your diet every day. Everybody would agree with that, Dr. Furman, Dr. McDougall. So whole foods, have it for salad every day, get legumes into your diet. And then it becomes a matter of what form you want the carbohydrates. And we are carbohydrate burning creatures. Our mitochondria preferably burn glucose as our preferred fuel, despite what the keto folks are trying to sell us there. So what forms of the carbohydrates come in? At a minimum, I think there should be whole grains, as Brother Davis tells us, whole rice, whole barley, whole millet, whole quinoa, etc. I don't think everybody will get in trouble on that. But there are a couple of starchy vegetables. What do you do about white potatoes, etc.? If you're a nice lean body weight, and your diet is just filled with healthy veggies, I don't think having a baked potato once or twice a week is going to cause you any great harm. And the pastas, the other processed starches, get ones that you use either whole grain, but now there's all sorts of wonderful lentil pastas now and quinoa pasta. Find the ones with the lower glycemic index that don't raise your blood sugar so much. And fruit, get her during the day is just fine. So I don't think there's that much conflict here, as long as you stay with whole plant foods and be respectful. But you can't do this on energy drinks and granola bars and eat whole plant foods. But if you do, and they have lots of legumes and lots of salads, and vegetable stews and soups and curries and chilies are such a wonderful cuisine. I don't think there's really much conflict. If you're trying to lose weight, yeah, you probably shouldn't be eating lots of mashed potatoes. That's true. But if you're already a lean, skinny vegan, enjoy some of these starchy vegetables from time to time. I think they're just fine.
So you mentioned Impossible Burgers.
Mm-hmm.
So let's just talk about foods that are in packages.
Yep.
One thing that I've seen over the years, when I was younger and more of just a vegan, where I was picking up a lot of food, I'm out, you just go into one of these quick places, and as long as it's vegan and, has something that looks like a vegetable in it, it'll be fine. But now, I'm older, and so I'm really more on the straight and narrow. Requires a lot of cooking, I find, a lot of thinking ahead, a lot of preparation. When I was just using oil and putting olive oil in a skillet, and you throw in some onions and you throw in some recipes and you throw in some beans, well, it takes more thought now. And so those processed foods seem to really help when people just don't have a lot of time. So how bad are they? Do we need to quit our jobs and have one person in every household home with the kitchen fires? Or can we sometimes have something that somebody else fixed?
Well, great question, of course. Um, I hear frequently about, well, this is all very nice stuff, but I don't want to spend all my day in the kitchen chopping and cooking and preparing these foods as you eloquently described there. Well, there's good news. We're in the 21st century. I urge everyone, when you go shopping in the supermarket, head for the freezer case. And in the freezer case, I guarantee you're going to see bags of assorted, cut up vegetables, preferably organic, bags of them, broccoli and carrots and peas and all sorts of green peppers, etc. Have 2 or 3 of those bags in your freezer all the time. And I came home from work yesterday, and my wife said, well, why don't you make a soup? No problem, man. You got a bag of frozen veggies, open up, throw it in the Instapot there, a box of vegetable broth, and pour that in there, cut up an onion and some garlic, put that in there, and let's see,
Probably beans.
no, yes, and open up a can of, thank you, and zucchini beans, and put that in there. And put on the Instapot, and 3 hours later, the kitchen was smelling a wonderful, delicious aroma from the vegetable soup, which we made a meal out of that night, but we ate off of it for 3 days out of the fridge there, and we froze a little bit of it left over. So there are ways to do an end run around the cooking and chopping, etc. And our friends on Sunday did both Sunday afternoon to food prep, and they've got a bunch of plastic refrigerator containers, the glass ones with plastic lids. And for 2 hours, they put on a podcast, and they do all their shopping and their cooking and whatever, and they put it in their container, put it in the fridge, and now they're set. Now they come home from work, and they already didn't throw together a no-oil stir-fry or a quick saute or whatever. There's make the soup or chili. So there's ways to do it, batch cooking, batch preps, etc., and frozen veggies. So there's ways to make it less onerous. And if you do a search online for quick vegan veggie meals, there you'll certainly get lots of advice on that. So there's ways to get around it without having to eat all processed foods. And I'm not a big fan of the frozen dinners, etc. They're full of salt and oil and kind of devitalized. And so they're kind of in a pinch. I'd rather, again, you make some dynamite, big batch of dynamite soup, a hearty vegetable, bean, barley soup, whatever. Yeah, half of it. But the rest, get these freezer containers, ladle the hot soup in there, let it cool on the counter, put lids on it, put it in your freezer. And now you got a freezer full of soup portions. You just bring out, heat them and eat them. And life's simple for yourself. So that's your own quick processed food. So finally, rounding up, of course, about the veggie burgers and the Impossible Burgers. I do not treat them with disdain. First of all, just on a plain biochemical, biological level, they are much better than beef burgers. They have no cholesterol. They don't have saturated animal fat. They don't have antibiotics. They don't have the arsenic and mercury that the animal drink from, in their water supply. They don't have the growth promoters and the uh, hormones that the animals are given. All the way around, they're a cleaner, better entree there. Is the bastion of healthy food? No, they're to no one's telling you to eat Impossible Burgers every day. But if once a week, and you want, or once a month, you want to have, well, we got some in our fridge and the freezer had been there for 3 months, I still haven't got around to eat. And then because those days when I might miss a burger, I'll eat one burger again, and then 3 months go by before I think about it again. But where they do have a valid role, I think an important one, is in my new patients who I've got a Joe meat and potatoes guy sitting in front of me who can't bear the thought of not eating a juicy burger. If he bites into an Impossible Burger, oh wow, that plant-based, oh, I could eat that. Yeah, he changed his life. He'd opened his mind up to a plant-based entree that's satisfying. So in that role, I think they have a valid part to play. So I'm not against them, but whole plant foods are still your ticket to health, no doubt.
Yes. So your book is just so beautiful, and so many wonderful people have said great things about it. And I just feel that just these endorsements in the front of your book, and he has pages, guys. I mean, because everybody admires Dr. Klaper. I mean, it is literally page after page. We've got Michael Greger here, Rip Esselstyn, Dr. Michael Greger, I should say, Rip Esselstyn, Dr. Brooke Goldner, Dr. Caldwell Esselstyn Jr. I mean, there's just nobody that does not love Michael Klaper and this book and all that it can do, is doing, and will do. You can find out more about Moving Medicine Forward on Dr. Klaper's website, movingmedicineforward.org. So as we wind down here, what's your overall message? If you had all the airwaves, if all of a sudden for a minute, everybody stopped, there was no internet, there was no network TV except that focused on you and your message, what would it be?
Mm.
I like the throat clearing first because everybody's
Okay.
listening.
Okay. Your health comes from healthy living. You can, whatever's going on in your body, you can improve your state of health by adopting a truly whole food, plant-based diet and working with your physician to taper down any medications you're on. Just call your doctor's office. You don't even talk to them. Just leave a message with the office nurse. Tell Dr. Smith I've adopted a healthier diet. I'm losing weight. Will she or he work with me to lower my medications if they become too strong for me? So all you have to say, yes, we'll tell the doctor, and then do it yourself. Your doctor is not living your life for you, as the Nike commercials say. Just do it. Just start adopting healthy breakfast, lunch, and dinner, and expect to see your body and your whole life transform. And the world will heal. The earth will heal. Our relationship with the animals will heal, and the earth and the life that we're going to give our children will be immeasurably better as we adopt plant-based nutrition. It's the hope for all of us, and the sooner we get out, the better.
That is immeasurably positive and wonderful. So everybody, read the book, Moving Medicine Forward, What More Doctors Should Know About Nutrition and How It Can Save Your Life by Michael Klaper, MD, and give it to your doctor. If you've never given a gift to your doctor, put a ribbon around it. Give it to your doctor, because he or she is as frustrated as Dr. Klaper explained being early on. They really went into medicine to make a difference and help them do it and save the world while we're at it. So thank you, Dr. Klaper. Thank you, everybody who listened. I do want to do a shout out for this program's sponsor, Complement, wonderful nutritional extras to supplement your excellent diet. And these are made by vegans for vegans. The website is lovecompliment.com. And if you happen to be listening to this program when it's newly out in late March of 2026, they're having a big old sale, like 30% off a bunch of stuff. If you put in Main Street, all capitals in the discount box, and whenever you're listening with that code Main Street, you get 10% off forever and ever. So wonderful to have a partner who helps make this program possible. So, Dr. Klaper, thank you for being a luminary and a legend. And thank you for being my friend. And thank you for being a friend of everybody's arteries and all the animals. You are rare and special.
Thank you, my dear friend. Together will help make a lot of people happier and healthier.
Good deal. And everybody else, let us just get out there and make Main Street vegan.